healthy as they used to be, and all of a sudden they're having to figure out school enrollment forms and health care and keeping up with small children again. I've been working on something I call the Kinship Caregiver Support Act. It's bipartisan. I introduced it several years ago to give more help to grandparents who are raising children later in life. Programs like the Muscatine Community-wide here in Iowa provide support groups and counseling and educational seminars, recreational activities. I helped to start a housing complex in New York City for grandparents raising children so they could be safe together. They didn't want to live in apartments where there were people that they didn't want to trust with their grandchildren, so it's all grandparents raising children, and they support each other. We've got to start thinking about how we're going to do more of that. And finally, as president, I will continue the work that I've started in the Senate to help seniors keep their independence and live in their own homes and communities. The work starts with our caregivers, the ones who are juggling the needs of sometimes growing children and aging parents, and maybe having to work full-time as well. And if everybody who is giving care to a loved one stopped today, it would cost $300 billion to replace that care. So this is not only the right thing to do, this is an economic service that is being done to care for people who cannot care totally for themselves. But just because family caregiving is unpaid doesn't mean that it doesn't cost. It obviously is very rewarding and important, but it can be exhausting and expensive. And I was proud to finally pass legislation I introduced called the Lifespan Respite Act to give temporary relief to those caring for their loved ones. I also think we should consider tax credits for individuals and caregivers, tax deductions for long-term care insurance. And now there's a new phenomenon where people are banding together themselves to help buy services that they will need in order so that they can stay in their own homes. So I'm very hopeful that we can really focus on a lot of these issues that seniors talk to me about. My 88-year-old mother, who has always been very independent, after my father died in 1993, she did not want to give up her home. She didn't want to, move in with any of her children. So she held on as long as she could. But it got to be difficult driving. And that's what really convinced her that she could no longer live on her own, because she couldn't see well at night to drive, and she needed, a little bit of help trying to read those road signs as she was driving, even when she was making the same routes over and over again. So I finally convinced her to come and live with me. And I'm thrilled that she is, and thankfully she's in good health. In fact, she goes to a gym and works out, which has made a big difference. Her doctor told her, he said, one way to maintain your flexibility and your strength is go work out. And I'm embarrassed to tell you, she works out more than I do. And the results really speak for themselves. She is thankfully healthy and in really good spirits. But we want to be prepared for what happens in the future. And I think that's what everybody wants. And what I want to do as your president is to help you be prepared. We're an independent people here in America, and I love that about us. But even the most independent of us may occasionally need some help along the way. And Social Security and Medicare have provided that help. We just have to make sure that they are up to date and providing the services that are required, and keep faith with the older generation, which all of us, if we live long enough, will be part of. And so what I hope to do as your president is to be a champion and advocate for America's seniors. Thank you all very much. Hear from our two special guests, and then we'll have some time and people can also share their own stories and ask questions about their own particular family needs. And I want to start with Pat. And Pat, if you'll introduce yourself and then tell everyone what brings you here today, the story that you want to share with us. Can you turn on the mic here for Pat? Okay.
I'm Pat Corbin. I live in Ado, Iowa. Try again. Okay. I'm Pat Corbin. I live in Del, Iowa, which is just 7 miles down the road. My husband retired from the insurance industry. He'd been with 35 years in 1994. And it's going along fine. But as soon as word gets out that somebody's retired, I think then the guys that are with another insurance company and want to sell you long-term health care start calling. So they began calling, and I would say, Joe, what should we do? And he'd say, well, we're just not going to do it. We're not going to buy into that. We're healthy and we're fine. We'll be just fine. Sounded good. Joe had some problems, some health problems, and in 1996, they diagnosed him as having Parkinson's. So I thought, boy, this is going to be a real bad one, because he could, I don't know, I hear him talk about people can lay with that disease for 20 years. And I thought, this could really be serious. So the next time an insurance company called, I told them that he had Parkinson's. They said, oh no, we don't want you then. We will not cover you at all. And that happened with several companies. But one day I had a call from a new company, to me, John Hancock, a very old insurance company in America. And this salesman said, I think we can help you. I think we can help you. He said, I'll come out and talk with you. So he said that they could write a policy that would say they would cover Joe for home health care, and they would cover me for nursing home care when I needed it. It was just perfect. Just what more could we want? If I could get someone to come in and help with Joe, it would be perfect. I didn't want to go to a nursing home anytime, but I've got kids, I can go live with them. But push came to shove. In October of 2006, Joe was diagnosed with cancer of the esophagus. And so I thought, uh-oh, now I better be looking for some help. I better just contact the insurance company now and see what kind of help I can get. So I called my agent. They're no longer in Des Moines, they moved to Kansas City, or the boy had anyway. But he told me he would get back to me, and he came and met with us in November. We were at the hospital waiting for his radiation treatment, but he said, things aren't good. They aren't good. He said, I'm going to give you the names of a couple of officials out in Boston, Massachusetts, which is their home office. And he said, you call them, you talk with them, they can tell you. He said, I can't do much to help you. This doesn't sound good at all. But when we got home, I called each of those individuals, and they both said, no, your policy says that unless you are both homebound, unable to drive, unable to care for yourselves, then you can both get home health care. But until you both need it, you have nothing. I said, you have to be kidding. I mean, that's as unlikely as saying that we're both going to die on the 4th of July next year. You know, it's just so unlikely. I couldn't believe it. Well, I just kind of thought on that for a while and kept taking Joe for treatments, but we kind of got through the 36 treatments and through the holidays, and then I started with, well, Joe said right away, called the state commissioner of the state of Iowa. He said they know what's going on. So I called the state insurance commissioner and talked with that office, and talked to many different people and talked with different phases of what we did have, but they said, could you send us a policy? And I sent them a copy of my policy, and they sent it back and they said, sorry, it says it in there, that that's all you have. And I said, that isn't what I agreed to, and I signed a contract at the end of the policy, and that's included in the policy, saying that this is what you're going to have. Home health care for your husband, nursing home care for you, but I guess the contract doesn't matter. I always thought a contract was good no matter what. I thought the contract would be valid, but not so. They said, no, we don't think so. But I wasn't content there. I went to Elderly Affairs, and they said, well, they're hearing lots and lots of stories, and they said, we're just touching on the iceberg of what's going to come with home health care. So there's going to be a real movement because people have figured out that maybe they can get help. Maybe there's something that can help them and get this thing straightened out. But she said, just stay in there. She advised me perhaps I could call the Great Legal Clinic. I called out there and talked to a lady, and she said, not the right time of the year. She said, students have all gone home. She said, they love to tear into insurance companies. They love policies. But she said, I won't have them back till August. And I said, I'll just continue paying. That doesn't bother me. I'll just keep riding along here because sometime I'm going to come head to head with that company. We're going to get something straightened out. But that gave me a little lull in time there. So then I talked with another investigative group that works for the elderly. I remember the name of that one. And I have